Hi everyone, Steve Adubato with my colleague Mary Gamba. This is Lessons in Leadership. Mary, how are we doing today?
Doing great, Steve. How about you?
Good. We have a terrific guest to kick off the program with who knows an awful lot about not just medicine, but leadership in the field of medicine. He is Dr. William O. Cooper, and he's Cornelius Vanderbilt Professor of Pediatrics and Health Policy and Associate Dean for Faculty Affairs, Vanderbilt University School of Medicine, and President of Vanderbilt Health CPPA. Doctor, thank you for joining us. And also, what does CPPA stand for?
CPPA stands for the Center for Patient and Professional Advocacy, a center we run here at Vanderbilt.
Great. How did you, before we get into anything about physician leadership, how do you wind up at such an extraordinary institution? And also, you came through us to our mutual friend and colleague, Dr. Andy Anderson at RWJ Barnabas Health. Please, doctor.
So, Steve, I'm a pediatrician, so I take care of children here at Vanderbilt at the Monroe Carroll Jr. Children's Hospital at Vanderbilt. And as I've come through my career, I've had the opportunity to take on leadership roles that required me to sort of work with my colleagues and help them be the best version of themselves. So about 10 years ago, I took over leading this center that we have here at Vanderbilt that has a national collaborative of helping physicians and nurses and advanced practice professionals be the best version of themselves.
Stay on this. We do a fair amount of leadership and communication coaching for physicians and other folks in the healthcare world. To what degree do you believe, doctor, that it is natural or less than natural for most physicians to be really good leaders?
So I would say that it really requires both, right? So the idea is that there are people that have innate leadership skills that often will have opportunities. When you choose, and as a physician, as a pediatrician, when I chose to pursue a line of service for really helping particularly children who are often vulnerable by many different life circumstances, that put me in a position where in order to advocate effectively either for the healthcare needs for the children that we serve or other things, I needed to be able to tell a story and to help bring other people along to help affect what I'm deeply passionate about.
Mary, jump in, because I'm fascinated by some of the elements that the doctor thinks are the keys to being a great physician leader after this. But go ahead, Mary.
In our research, I had found a great video of you talking about the connection between passion, finding that passion in your profession, and success. And I would just love for you to share that with our audience. I have a 19 and a 22-year-old, and as I was raising them, I said, find what you are passionate about. Follow that path. Find what just makes you happy and brings you joy, and be the best at it. Talk about that and how that relates to professionalism and passion in healthcare.
So, Mary, when I was in training, I was a resident physician at Cincinnati Children's Hospital in Cincinnati and took care of a series of patients who suffered really devastating health consequences when there were changes in health policy. At that time in the early 1990s, we had changed how newborn care was delivered in the hospital from staying several days to now being able to stay really one day or at most 2 days. And that's probably fine. It turns out for the vast majority of babies it is. But for a very small proportion, if we don't change the follow-up system, we may miss some challenges. In this case, I took care of a series of babies who developed severe problems with breastfeeding and developed really severe dehydration. One had to have her leg amputated because she got so severely dehydrated. One had a stroke. And that sparked in me a deep passion to try to understand how it is that we prevent unintended consequences of health policies from affecting children, some of our most vulnerable populations.
And that's your passion, doctor. But let me ask you, as you interact with your colleagues, teach, coach, mentor others, is it fair to say that virtually everyone you interact with in the medical field has some passion that they're following? Because I can't imagine you could be really good, a really great clinician without that passion to care for others.
Absolutely true. You really do need a passion for something that drives you. And so when I think about colleagues that I've encountered, many of them may have stories like I've had. Others may find their passion through their personal health experiences or the health experiences of loved ones. And so whatever that is, we really spend a lot of effort as we try to lead physicians to help them be able to not only understand that, but align their portfolio of activities around that.
quick follow-up before Mary jumps back in. A fair amount of the coaching that I've done helps physicians communicate complicated, clinical, technical, complex things to people who did not go to medical school. How important is it that clinicians, regardless of how smart they are, how effective they are as clinicians, as surgeons, whatever, to communicate with the rest of us in a way that we understand and appreciate?
One of the really key skills that a physician must have is to be able to tell a story or convey things to a variety of patients and family members who may have a range of education. And so that's a really essential skill. And you learn that over time. Like, I'm certainly better at it today than I was 25, 30 years ago when I started practicing.
Are you confident, doctor, that just happens over time, or was it a concerted effort on your part to get coach trained and developed in that area?
I think it requires a fair amount of intentionality to develop your communication skills as a physician. And like that, you have to get feedback and learn how that conversation went. So I believe it's both an acquired skill, but that has to require practice. And I get better at it all the time. I continue to try to think about ways I can be most effective in engaging with my patients and their families.
Mary?
You're making me think about lifelong learning. Steve and I talk about that a lot on Lessons in Leadership and the importance of professional development, lifelong learning. Talk about your approach to that, especially when it comes to collaborating with others, learning from others, and really helping that to get to, you said you've learned about your communication skills and techniques over the last 20 years, but where does that lifelong learning and then also working together with those mentors in your world fit into leadership?
Mary, you've hit on something that makes me love my job so much. I love what I do. I can't wait to get to work every day. That's because being able to work with people who have their own passions, being able to help them understand what that is, and as a leader, to try to help either make sure the systems are there to support them to be effective, or when they need a little bit of a course correction, to help nudge them in that direction. And that course correction is really the crux of the work we do in the Center for Patient and Professional Advocacy.
And real quick on this, Doctor, what is your message to parents right now of small children? Because there's so much information, misinformation, confusion out there. Where should people be getting their medical and health information from, in your view, particularly as it relates to their children?
I really try to meet my patients and families where they are. I try to understand what their perspective is, what their fears might be about various treatments or other things. And then I try to use that, coming from a position of mutual respect, to say, here is why I have found this to be an important thing, both as a parent and as a pediatrician. And I'd love for us to develop a trusting relationship where we can reach common ground, because we're all on the same team to provide the best care and the best outcomes we can for your child.
Well said. Important. Doctor, thank you so much for joining us. We appreciate it.
Thank you. Have a great day.
This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers, Local 825, the North Ward Center, the New Jersey Sharing Network, Delta Dental of New Jersey, the Helix, Fedway Associates, Inc., the Port Authority of New York and New Jersey, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media.
At Delta Dental, we do more to make benefits easy to implement, use, and understand. It's why businesses large and small trust us to keep their employees smiling. Year after year, we make our clients and members happy with unmatched expertise and great dental benefits. We apply our decades of experience to give you more guidance, providing plan design options and cost-saving measures. With reliable support for you and your employees, we make administration effortless and free up your time so you can focus on other business needs. We even do more for vision care with Delta Vision. Choose Delta Dental and discover what the power of more can do for your business and your employees.
All right, Mary and I are back. We've got our good friend and colleague, Dane Evans, who's the CEO of Skoda Contracting. Good to see you, Dane.
Hi, Steve. Thank you for having me. Good to see you too.
Is it not true? Do you admit that there is, in fact, a Skoda Contracting Leadership Academy that a relatively pretty good leadership coach is leading right now?
That's right. We thank you very much for your services, and we're looking forward to year two.
I thought he was going to say, no, Steve, you're really terrific, but that was shameless. Hey, set this up for us, Dane. The website is up for Skoda. Tell everyone what the company is and where you do what you and your team do.
Sure. So we are a third generation family-owned business. We specialize in underground utility infrastructure construction. So what that means is that we build underground pipeline systems and do the associated services for utility companies around the Mid-Atlantic. We're headquartered here in New Jersey, where you are, and then we work in Pennsylvania, Delaware, Maryland, Virginia, D.C. So Mid-Atlantic, but headquartered in New Jersey.
How do you find yourself in this field and at Skoda?
Yeah, so I'm the third generation of family leadership and family ownership. My grandfather started the business in the 60s. He was an immigrant from the Czechoslovakia, now the Czech Republic, and knew how to weld. He came over when he was 14 with $10 in his pocket and had a trade and started this business. My father took over in 1979 and built the business, and I got into the business in 2011. So I'm, about 14 years in here.
Interesting. Before Mary jumps in, I also know one of our mutually, a book that both of us like, Extreme Ownership. You know one of the authors here who has done some coaching, if I'm not mistaken, right?
Right. So we send our kind of middle management level team and different people each year to Echelon Front's leadership school. So it's a 2 or 3 day seminar run by Jocko and his team, and it just teaches accountability. And a lot of the principles that they teach in extreme ownership are very applicable to us in the construction industry. So being responsible for every blade of grass that you and your team touch, and me as the leader at the highest level, I'm responsible for every single person and everything they do every day. And we really take that responsibility very seriously. So I love their philosophy, and we're glad that they're sharing it with our people.
Yeah. And by the way, Extreme Ownership will remain the top book in our leadership library. Go on our website and find out more about the other books on leadership that matter. Go ahead, Mary.
Dane, one of the greatest things since we've known you and we really have gotten to know you, your team, and Skoda is the culture that you have built. And now you're learning more, your father, your grandfather. It's all over your website, the photos. Go to Skoda's website. We're going to put it up right there on screen. It's just fascinating how you create that culture. Do you have a leadership tip tool for others that are watching, how you can truly ingrain a culture of caring for your people first? Sure, you've got your clients and all the work that you're doing, but at Skoda, it's truly a culture of your team first, and you want to make sure that you're supporting your team. Talk about that.
Sure. So I was very lucky to inherit a very strong culture when I took over the business. One of the things that we really focus on is continuous improvement. So we're constantly investing in our people, whether it's with services like yourself, where there's, leadership seminars and leadership training, but there's also that family aspect. And that is every week we're looking at who needs help within our organization, whose grandmother is sick that they are responsible to take care of, who missed time because of their, they had their son's hockey game, whatever it is. We want to make sure that we are taking care of our people, and that when they have to prioritize something outside of work, it gets noticed, it gets recognized, they're taken care of. That on top of just having a real respect for the craft labor, the machine operators, the laborers, the pipe fitters that work for us, and knowing that they're taking care of us every single day in the field, that we need to treat them like family, take care of them. And that culture is something that builds on itself. We're very team focused in the sense that people pick up the slack for each other. They treat each other with a lot of respect. The other side of that is we promote the right people. That is something that is very, very important to me, is when you promote someone that is aligned with your company's standards, that's aligned with your company's goals, that's sending a message that these people are doing the right thing, and promoting someone, showing someone, off or highlighting someone's attributes, that when they're really aligned with your culture, that sends a message to the entire team. The converse of that is when someone is not fitting in, they're a toxic employee, they're a culture cancer, you need to cut them out right away. And my team knows that. It doesn't matter if they're putting points up on the board, if they're extremely talented, if they're not a culture fit, you need to remove them right away.
Real quick follow-up on that, Dane. I
Sure.
appreciate the comments about a family, and Mary and I have this discussion all the time. My wife, Jennifer, says, you think that the organization is a family. She goes, it's family, but it's not family. Meaning, Mary and I care about each other on a personal as well as a professional level. But they're different people and you don't have the same relationship. So what I'm trying to get at is this. Do you actually believe that at Skoda it's family? And do you distinguish that from your family? Because sometimes the family at work, in quotes, you have to tell some very hard truths to that they don't want to hear.
Right.
Fair? Go ahead.
Yeah, so we don't say family, we say like family, which there is that little difference there. But
good qualifier, I like that.
But what's really important is, as a management team, as a leadership team, we want to have a very transparent message to our staff, to all of our employees, that these are our values, this is our space in the industry, and this is what we think is important. When you have that transparent message, everyone can get on board with that. Whether it's treat people like family, take care of each other. We're the high quality player in our space. We're never going to be the biggest player. We're not the low cost service provider. We're the very high quality player in our construction space, in our specialized space. And everyone that works here understands that. And that means caring more, going above and beyond. And when you set those kind of transparent goals, you can hold people accountable to the goals, you can measure those goals, and you can reward people for, basically following through and meeting the goals. So it's not family in the sense that there's unconditional love. It's family in the sense that when someone is, just getting back to your question, when someone is in need, and they're one of your people, you take care of them.
100%. And that doesn't preclude the need to have hard conversations, which I know Dane and I have had so many conversations about the need to give constructive, honest feedback. By the way, we need to do it with family as well. It's just that with family, it's riskier sometimes. I mean, leave it at that. Hey, Dane, I want to thank you so much for joining us, A, and B, being a terrific partner of ours. It's one thing to say you're a client, but the reality is we've collaborated and partnered and frankly shaped and reshaped and pivoted and adapted to your needs, as opposed to here's our product, buy it or not. And that's a big part of your success as well. Thank you, Dane.
Thank you, guys.
You got it. This is Lessons in Leadership. Stay with us. We'll be right back.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague, Mary Gamba, has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media. Welcome back to Lessons in Leadership. We have a few minutes to discuss a not so controversial, not so difficult issue to talk about. Let's do it. How about leadership and DEI, diversity, equity, inclusion? Let's talk about it. So, Mary, here's the question I keep thinking about. So, how the heck do we take politics, this is not a show on politics, it's a show on leadership. And if you watch the show enough, Mary, we did 200 episodes plus now, right?
Yeah. Yeah, 207.
Yeah, something like that.
This is our 207th.
Okay. All right. Well, if you know the program, you know that we don't do politics, and we don't care whether you have a D after your name or an R, or you don't vote. We talk about you behind your back as a leader, and we analyze leadership issues. But here's the thing that's tricky. How the heck, if you're a leader of an organization and you hear what the president is saying, who's a significant leader and his voice matters, his actions matter. If the president is saying, President Trump is saying, we're going to end DEI, diversity, equity, and inclusion, what the heck does that mean for a leader of an organization, a team, or whatever, who wants to promote diversity, equity, and inclusion?
Any blanket statement across the board saying that you're going to do this, you're not going to do that, you can't just come in and wipe away anything in life, right? Unless it's plastic bags in ShopRite because they want to save the universe or something. Like, okay, we were able to adapt to that. When you're talking about DEI as a blanket statement and saying, all right, we're going to stop these efforts, what you risk is going backwards. And then, sure, in certain situations, and you and I have talked about this before, and we can, bring it up a little bit now. My niece is going, she's in medical school. She's a second-year medical school student. Right. You want to have, whether you're male, female, black, white, identify in a certain way, not another way, they should be bringing in the best
just
qualified.
Merit? Is it just merit?
It should be just merit when you're talking about who is doing your brain surgery. Merit. If you're having surgery done, I want it to be the most qualified individual. I don't care if they're, that does not matter.
Meritocracy?
Right.
Meritocracy, that's it, right?
When you're talking about the medical field, if you're talking even about the military to some degree, remember my husband
about the military and the
and I was going to say my husband, and I can do this from a firsthand experience. My husband, 25 years in law enforcement, he had to go up against some pretty big guys, okay? Men, gigantic men, 6'7", 400 pounds. And if there was a me next to him, I'm not going to be able to help in that situation.
So if you created more diversity in the corrections operation because we had a DEI initiative, you're saying that's bad leadership because you wouldn't be able to do what you need to do. And Pete Hegseth, who's the defense secretary, right, is saying, enough of this diversity, equity, and inclusion. Merit is all that matters in the military. Mary, just get your point out because we need other points.
I will. And that's my point, is that it should be on a case-by-case basis, not some blanket statement that you're doing away with it. And I'm dropping my papers. That's all I have to say.
That's it. Alvin, go. Leadership and no. Oh, you're going to beg out of the conversation on leadership and diversity?
Go ahead. Ask your question. Ask your question.
I'll ask the question. You and I have had these offline conversations, and you know that part of our culture is to attempt to have different voices, different faces, different people, different experiences, mix it up as much as possible, and have the best people. Where is the place for diversity, equity, and inclusion in an organization that simply wants to be its best? Because the president says, Pete Hegseth says, has no place. You say?
I think you need DEI in every company, but here's the thing. I feel like you still should hire the best candidate, but you need DEI because of the fact that sometimes you won't look at a certain candidate and they need to be looked at. And this is why you need it. So
I just have to jump in real fast. I agree 100% with Elvin. In business and in companies and in industry and in manufacturing, DEI is needed. I'm just talking about solely, I think that you just need to be a little bit more cautious when it comes to who's doing your brain surgery.
Medicine and military.
I think that it's just let the best candidate.
Pure merit. I'm not going to put words in your mouth. Pure merit.
Well, for medical merit and for law enforcement, size, strength, and being able to help somebody if they're in a difficult situation.
Okay, because as Pete Hegseth, when he was his previous comments, he, based on the same standard, he said, and then I don't know if he changed his mind, it's not political, it's leadership and public communication. He said earlier, women should not be in combat. And it was largely based on the discussion we're having right now. not capable of doing it.
You saw
That's
that
what he
tiny
said.
woman trying to get Trump down on the ground when he was being shot at. She weighed about 120 pounds. She couldn't knock him down to the ground.
Frank, leadership and DEI, and separate military and medicine.
That's a lot, because leadership and DEI, the bottom line is this: DEI is a necessary so that people who may have been looked over initially because of who they are.
That's right. Or who they're not.
And who they're not can be seen and possibly identified as that great brain surgeon, that great president, CEO of a company. Of course, they need to work their way up, just like most people. But there's so many people in these positions who have not worked their way up, and they get placed there, and they're still substandard. Okay? Can you think of anybody?
And I don't mean to cut you off, Frank, but I was offered a job someplace. They wanted me to, and I already worked at this place. I went through the whole interview process, and then they said, "You don't fit this position at this time."
And let me ask you.
And I was like, I don't understand. I'm already here on the regular. How don't I fit this position at this particular time?
Do you think that was code for something else?
I know it was code for something else.
You know.
I know.
You're sure. And you think it was a personnel decision based on race?
Not race. Male.
Oh, gender issues.
Wow. Oh, okay. Hey. So, Mary, let me ask you a question. I got a minute left. Every leader of every organization, whether this is an uncomfortable, difficult conversation or not, everyone's going to have to deal with this. Everyone. I don't care, military, medicine, media, any industry, you're going to have to deal with these issues, and you can't duck them.
Right.
And wow, this is going to get interesting. I don't know if we solved anything. I just know we had an uncomfortable but candid conversation. So for Frank, Elvin, Mary, Scarlin, April, Sylvester, and who am I missing? Amy on closed caption. This is we're diverse, but the reality is more important. We're the best. See you next time. This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers, Local 825, the North Ward Center, the New Jersey Sharing Network, Delta Dental of New Jersey, the Helix, Fedway Associates, Inc., the Port Authority of New York and New Jersey, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media.
At Delta Dental, we do more to make benefits easy to implement, use, and understand. It's why businesses large and small trust us to keep their employees smiling. Year after year, we make our clients and members happy with unmatched expertise and great dental benefits. We apply our decades of experience to give you more guidance, providing plan design options and cost-saving measures. With reliable support for you and your employees, we make administration effortless and free up your time so you can focus on other business needs. We even do more for vision care with Delta Vision. Choose Delta Dental and discover what the power of more can do for your business and your employees.